The last thing I'll say is there's going to be a portion where we talk about the injunction. The idea for this debate, I want to give credit, was Adam's. He emailed me and said, would you host a debate with me and Jennifer? I reached out to Jennifer. She said, I'm totally down. With regards to the injunction, there's an active lawsuit against the city, and the city isn't here right now. I am not the city, Adam is not the city. So there are going to be some questions that we can't talk about, and I just want to make it clear that this is not a conversation between the city and the Coalition on Homelessness, okay? I think those are all my ground rules. Those are all the things. Let's get into it. Please welcome to the baby stage, Adam Mesnick and Jennifer Friedenbach. Space for them. It's hot. We couldn't afford a total HVAC upgrade. Sorry, this was a sushi restaurant before, so.
It's okay. It's okay.
It's for lunch. Okay. 1, 2.
Okay.
Yes, that works. All right. I have actual questions prepared. How about that? First of all, I want to say what I said to you in the kitchen, the actual kitchen of Manny's, I want to say out loud, which is thank you both. Thank you for trusting me. I think it says a lot about Manny's and what we've done over the last 5 years that both of you feel comfortable being in this room right now to talk about the sensitive issue. So I just want to start with some grace and say thanks for that. And then I'm going to get into the personal. What is your connection to the issue of homelessness, and how did you get involved in this work? Let's start with you, and then we'll go with you. And just speak right into the mic.
I would say my introduction to the subject happened by accident. I've become an expert.
All the way up, you're going to eat it.
I've become an expert on the subject of homelessness, drug addiction, and mental issues. My biggest challenge at this point is the lack of humanity and the inability to understand the suffering that I have witnessed south of Market. I come today with my personal experiences. Everybody has different experiences, and my experiences for the greater part of about 10 years have been dismissed. These dismissals have been met with opposition, met with name-calling, white supremacist. I've been called racist. I've gotten death threats. I have an opinion. My opinion is based on my experiences. I have found 2 dead bodies, one in 2023, one in 2019, both walking my dog outside of my home. If you've seen the conditions on 7th and Mission, and you can look at me and honestly tell me that that's humane, then I will give up, I will bow out, and I will leave. But I don't think it's refutable. I don't think my position can be debated. I think my position is 100% accurate, and I think it's only a matter of time before everybody in this audience agrees with me.
All right, thank you, Adam. Jennifer, your connection to this issue, and how did you get involved in the work of addressing homelessness?
Yeah, hi, good evening everyone, and I just want to thank everyone for coming. It says a lot. It says a lot that you are taking the time out, that you care about this issue, that you're looking for solutions. I'm the director of the Coalition on Homelessness, and I began my career at the Hunger and Homeless Action Coalition in San Mateo County, doing a lot of welfare rights work. I was the chairperson of the campaign to stop, at that time, Governor Pete Wilson's 25% cut to welfare. At the same time, he put on the ballot a big tax cut for rich folks, and that's where I kind of cut my teeth. So I don't really like talking about myself, but I'm a mom, I'm a neighbor, I understand folks' frustration with this issue, and I totally agree how painful it is to witness abject poverty, to witness mental illness, let alone how painful it is for the folks who are stuck out there living out on the streets. And so my work is really around centering the experience of unhoused people and what they are calling for in terms of solutions. My work's also grounded in really trying to find evidence-based solutions, and luckily the recommendations from both totally align. And so last thing I just want to say, just on a more of a personal note, one of the things one of the reasons that I do this work and why it's important to me is this idea of home and how important home is. And what I see on a day-to-day basis, like without a home, we humans just can't flourish. We can't stay healthy. We lack the touchstone that allows us to just breathe, a door to lock, a shower to luxuriate in, a bed to sleep in. These are all things that one cannot do without a home. And so, that's a big thing for that. And then, I come to work every day. I've been doing this for a long time. It's difficult work. I come to work every day with the intent of working myself out of a job.
Thank you. I'm going to stay on context for a second just because there's a lot of folks who think they know what each of you does, so I'm going to let you say it for yourself. So we'll stay with you, Jennifer, for a second. The Coalition on Homelessness, what does it do? What is it advocating for? What is the actual work of the coalition?
Yeah, so the Coalition on Homelessness is an organization that does community organizing, so pulling people together with the common goal. And so we organize homeless people and frontline staff to find permanent solutions to homelessness. And we work to protect the human rights of folks who are forced to remain on the streets. So we do a ton of outreach to people. We have a bottom-up structure in the organization. And then we use what's called in community organizing a diversity of tactics. So we do research, we create policy papers, we work on legislation, we do media work, we sometimes go to the ballot, we also use the legal system and do lawsuits. And then all of that really coming from what unhoused people and research is saying are solutions.
Okay, and Adam, you wear a few different hats. Can you talk about the different hats that you wear, and maybe also just spend a little bit of time talking about the Better Soma Twitter account and what the kind of goals of that account are and the story of starting it?
Sure. For a full-time job, I own Deli Board. I'm a chef by trade. I started Deli Board in 2009, and at the same time I moved south of Market. I actually sold my house short in a foreclosure, a different version of a homeless story. But I landed in Soma. Since I've been in Soma, I've had 4 different restaurants since 2009. Deli Board is the only one that stands. I was appointed in 2000 to the Soma Stabilization Fund, which was a community advisory council. I was appointed by Hillary Ronan and Matt Haney. Shout out to Matt Haney and Hillary. I am also...
But no reactions.
But no reaction, because I don't work for the city. I also am a board member, an active board member on the Soma West Community Benefit District. So I am fairly involved in both the business as well as, housing agenda down in south of Market. So I'm highly interested in that. And the Better Soma account on X, actually, is no longer Twitter. The Better Soma account on X is a very shocking and horrible, awful depiction of my experience in San Francisco. It is literally a walking path of my journey. I don't go out of my way for the photos. What you will see on Better Soma are different characters, what I believe to be humanizing of homeless people. I think that you see information in regard to overdose statistics, and you see a lot of data in regard to recovery and changing and switching the status quo from the current regime. One thing that I'll echo here, and then I'll give up the microphone, is harm reduction in Better Soma's mind is an epic fail.
We're going to get to harm reduction and addiction, but I just want to, we've kind of started with personal context. I want to get your assessment of how you things are right now on the streets as it relates to homelessness. So I guess if you can give a grade. I know it's tough and it's a broad brush, but both of you have kind of, been involved in this issue or witnessed this issue for a while. How would you say things are today, now? What grade would you give kind of the state of things? Adam, why don't we start with you, and then we'll go to Jennifer.
I think it changes from neighborhood to neighborhood, and I think that it depends on where the city is hurting people. And I will say that I think hurting is a technique that the city has used, and I think if you see that there's people on 45th and Balboa, 10th and Camden, chances are they came from south of Market. But the reality is it's a revolving door, and there's a lot of rinse and repeat. I would say right now I'd give it a D-.
Okay, Jennifer?
I'm way too nuanced to give a letter, so that's kind of a struggle for me. I would say the city's street response I would grade really low in terms of that piece of how effective it is. I think that I would probably give it a D or so.
Agree.
And then I think it has been a lot of strides on housing, on some really positive movements within the mental health system, some positive stuff within the substance abuse treatment system. So I think there's movements in the system that are really positive, that are not moving quick enough, but I would maybe give a B-.
Okay. I just have a couple questions. Again, specifically, we're going to go back and forth. As you can see, I'm warming us up into the direct debate part. But this, I think, actually came out today. I have to read this quote. The mayor said about the coalition, quote, "They will film our city workers. They will try to tell our workers what they can and cannot do. These activists are the same people who hand out tents to keep people on the street instead of working to bring them indoors, as we are trying to do. And they are the same people instructing and encouraging people to refuse shelter, to remain on the streets instead of going indoors. Do you provide tents to people sleeping outside, and are you encouraging people to refuse shelter and remain on the street instead of going indoors?"
Yeah, the tent thing's been kind of interesting because all these people have been calling our office for tents, and then the mayor did that. But no, we don't distribute tents. We did for a minute at the beginning of the pandemic. We did it actually in collaboration with Department of Public Health because they were trying to shelter in place and everybody was worried about the spread of COVID and stuff. And that was for a minute, but we haven't. Of course, we're always constantly every day. How much time did I spend today trying to get somebody into shelter? We're constantly trying to help get people into shelter. And when we go out on the sweeps, what we're usually doing is, we're monitoring because we're in the middle of this legal thing, but we're usually engaging in conversations with unhoused people, trying to figure out what they want, and then we're pushing the city. So yeah, sometimes we do tell the city what to do. So there was this sweep I was at, and it's not like telling them what to do, but it's suggesting. But I ran across a pregnant woman, and the street team's not really used to dealing with kind of outside of the box situations, and so they told her that they didn't have any space for her anywhere, and so I knew how to get her in, so I made a phone call and I got her in, and then I had to talk the team into providing transport. They had to take her first to a clinic to get the TB clearance and then into the shelter. So that took a little bit of negotiating. So sometimes we're negotiating and trying to, but obviously what we're trying to do is get folks off the streets, and that was successful. A lot of times we really don't have the system capacity, and so sometimes we're not successful.
Will you make a pledge to San Francisco that you won't pass any more tents out?
Like I said, it was during the pandemic. That's not what we do. Yeah, I know that's not in our bailiwick. Yeah, so.
I just think it's fair to make a pledge to San Franciscans that tents are not going to be passed out.
Okay, fine.
It's not to me. It's
okay.
I don't know. What if there's another reason why we should?
How about this? Yeah. Give them a tent, then give them a bathroom too. Where are the bathrooms?
Yeah.
Where are the bathrooms? So you pass out tents.
Yeah,
Well,
I already said I didn't pass out
I think
tents,
she said
so-
that she didn't pass out
In the
tents.
beginning of COVID, you passed out tents.
Yeah, but that's because Department of Public Health asked us to.
Yeah. So what
So
she's
it's the
what she's
Department
saying.
of Public Health's fault.
No, it's not their fault, but it's because there was a health reason to do it.
Would a health
Well, let her-
reason like fentanyl abuse be a reason to get somebody out of a tent and into treatment?
Okay, let's go back to the questions. Okay, let's get to the injunction. The first question to you is: how have you seen the city change since the injunction? Do you think things are better off, Adam? And then
You know the injunction here. The injunction, in my opinion, was kicking the city when it was down. COVID was absolutely a destructive time and place for San Francisco as a city. When COVID was actually giving up a little bit, the city gets an injunction filed against it by the Coalition of Homelessness, which leaves tents completely everywhere. Now, you're stepping out of COVID and you're trying to recover, and the neighborhoods are completely littered with piss, shit, and tents. Now, if there's no bathrooms and there's tents, where the people are expected to go to the bathroom?
okay. Thank you for the answer. I'm gonna now ask you, Jennifer, to just explain why did the Coalition on Homelessness sue the city? What is the goal?
Yeah, thank you for that question. So, first off, the big goal is to try to get more housing and shelter, get more folks off the streets. And since the injunction has been in place, shelter placements and encampments have increased. They've increased from 40% to 50%. So, little tiny bit of movement there. But why we sued the city is that we had been working with the city for a long time to try to get them to have a humane and effective, and I want to really emphasize the word effective, street response that led to folks getting off the streets. And we had been working with them in developing internal policies. The policies that the city have are good. The problem is that the practices are not, and they don't follow their own policies. And so there's two main points on the lawsuit. One of the things is that they had cited and arrested 3,000 people without offering shelter first. And that is against their own policy and also against the against the law. You're supposed to, it's considered cruel and unusual punishment under Boise versus Martin. So, for not offering shelter. And so, the second thing is that the city was destroying people's property, and we had worked out an agreement that they were supposed to store people's property. Now, nothing about the injunction stopped them from doing encampment removals. And in fact, since the injunction went in place, they've been doing 3 encampment removals a day. And they've continued doing it. It's only saying, and I'm going to repeat it because it really needs to permeate here, we're talking about citations and arrests for people who have no other choice but to be homeless. That's it. It's not there's not a lot of drama more than that. And so basically, if we want to be data driven, we really should not have the street response that we have. If we're taking people's property and throwing it away instead of storing it, it means they lose their paperwork. It makes it very difficult to get housing. It kind of makes them start from square one again. Citations and fees, and then you get bad credit, etc. That ends up affecting your ability to get off the streets in terms of trying to get housing. So we really want to see a street response, and this is another part of the goal, that is working with folks to get them off the streets in an effective way. And we've done it in San Francisco. We're doing it in some of our teams. There's a new team called BEST that's doing really wonderful work. When we have done a encampment resolution response that follows the national standards that have been put in place in the national, from the Interagency Council on Homelessness, we've had a success rate of 70 to 100% of getting folks off the streets and into appropriate placements. When we do this kind of parachute response where we parachute in, we throw away everybody's property, we do the arrests and all that kind of stuff, we get very few people into shelter, and the end effect of that is that we're just moving people from block to block and they're going to return. So it's ineffective. So we're really trying to get the city to have a more thoughtful response that increases the percentage of people getting off the streets. So far, we've had a little bit of success. We're not all the way there. 10% is nothing to, scream about or anything, but jump up and down about, but it's a little bit better than it was before the injunction, and we'll keep working on that. And we're more than willing to sit down with the city and work out. We put out an olive branch letter. It had very moderate requests, just asking them to follow their own policies, ask them to fix the housing reservation system is very broken, and so is the shelter reservation system, asking them to do some very moderate things that they've already agreed to. Right. And we were more than willing to continue that conversation, and if they're so worried about the injunction, we could just agree on that.
Okay, Adam, I want to give you the opportunity to just kind of, after Jennifer explain what the injunction is about, what is kind of your reaction to it?
My understanding is that they made some movement on the injunction, and they decided that if people are going to be voluntarily homeless, and that's their choice, then there's going to be a different path of action for them, is my understanding.
So let's talk about the voluntary homeless thing. That's kind of been the crux of it more recently. What do you think San Francisco should do if someone is on the street and does refuse shelter? This is this idea of if the shelter bed is offered to them, they refuse it. What do you think the city's response should be as well, Jennifer?
Well, the question would be, do they have any rotting limbs? Are they in need of medical doctors?
Can you address that to Jennifer?
Yeah.
Yeah.
Well, let's let him finish his answer.
Oh, go ahead.
No, go ahead, Jennifer.
No.
Go.
Well, Adam, please.
No. Go.
Okay. So, all right. So basically, just want to correct it. It's not recent. The entire premise of the lawsuit is that they were citing and arresting people without offering shelter. That voluntary homeless thing was the key part of our lawsuit to begin with. It continues to today. And I don't mean to laugh, but it's just kind of, yeah, it's just so strange how this pathway has gone. So it's always been about people who have no other choice but to be on the streets. So what your question was, what do we do if people refuse shelter? And just one of the things I want to build a little bit of context here, because currently the city has on their street operations enough shelter beds to offer about half of the people in encampments. Those are the number of shelter beds they have to offer. And the way they do it is that they summarily, for the other 50%, they just say refuse shelter, whether they refuse shelter or not. So that's the practice on the forms, and we've got all the backup documentation and all that stuff, and so so what we're trying to do, with a system that's going to work well, is we're going to want to have an appropriate placement. With regards to the lawsuit, if someone refuses shelter, then no, they don't have that constitutional right in terms of cruel and unusual punishment. And according to the lawsuit, yes, the city could cite and arrest them. Do we think that's a good idea? Obviously not. What we would want to see the city do is address why they're not going into shelter and try to figure out a more appropriate placement. I'm just going to give a couple examples. So on one of the sweeps during the injunction that I was on, there was a man who really wanted to get into shelter, but he had been raped in shelter. It wasn't a shelter in San Francisco, but it was a surrounding county. And he said, I can't go into a congregate shelter because I cannot sleep. My PTSD kicks in. This was a really horrific experience for me, and I can't do it. And so what happened then is, of course, he gets marked down as refusing shelter, and he has no way to access shelter at that point that's appropriate. So for him, you want to work with that individual for the appropriate shelter. So that's just one example. Another sweep I was at, someone was in a wheelchair, was offered a top bunk. That wasn't appropriate, obviously, either. So you want to keep working with people. Maybe it's not shelter. Maybe the appropriate placement is housing. Maybe the appropriate placement is treatment. Maybe they need a boarded care facility. Maybe they need to go to Laguna Honda. Maybe they need a whole nother co-op because they have a mental illness. So there's a variety of needs that people have, and that we need to work with folks to figure out what the need is, because the assumption that people want to be out there is just not correct.
All right, Adam, I want to give you the opportunity to respond, and specifically the question of if someone does refuse a shelter option, what should the city do with that person?
Well, I think first of all we have to back out the term homelessness, because I think it's very broad, I think it means a lot of things. I mean, homelessness south of Market on 7th and Mission is a drug-addicted, mentally ill individual that needs a medical doctor. So that is not what I don't consider that to be somebody who needs a house. Most of those people won't enter into buildings, let alone sleep in a house. So I think that unfortunately, the city and the coalition should really do a better job of defining the term. The term is very loose. Mentally ill, drug addict, and doesn't want shelter may need a doctor. Do these people that get interviewed, Jenny, do they have a social worker or do they have an assigned person at the city who they can be represented by and can be a champion of hope? Or somebody who can say, this person is mentally ill. This person does not need a house. They're severely schizophrenic, and use medical doctors and not evidence-based?
You know, it depends on the situation, but one of the things that that has been some recent progress is with Mental Health SF is that they started doing this Office of Coordinated Care to try to get case management connected to people with severe mental illnesses to really work with them, exactly what you're talking about. The waiting list for that is really long. And there's been some challenges in terms of hiring. There's a huge clinician shortage, so there's some real barriers there.
Wouldn't the financials be better off served as opposed to an injunction as kind of a stepping stone for good health, or a stepping stone for better treatment for the individuals on the streets?
We worked really hard on Mental Health SF to get that legislation passed, so to make sure that that folks did have that connection to care.
Yeah, let's talk about mental health for a second. There's a debate going on in the city that has been a while about what the line should be, about how much agency, or to what level, how much agency we give to the person suffering from severe mental illness on the street to take care of themselves, versus for the government, the state, the city to require care for that person. What do you think that line should be? When should the government intervene to require care for someone who's severely suffering of mental illness on the street? What do you think the line should be? When should the government intervene? And I guess what I'm asking very directly is to not actually, to take away their agency to take care of themselves and require it of them.
I mean, if you enforced a lot of the rules, a lot of these people would probably be in jail, right? So they could find a way to get sober in jail. Because again, my version of the story is about drugs and addiction, and that's what homeless is to me, at least in South of Market. So with the drug addiction, I think you have to either find a way to get them into recovery or some sort of medical treatment facility where they can recover and then get rehabilitated and back into jobs and training and things like that. I have an employee, his name is Jojo. He actually lived in the Tenderloin for about 4 years, homeless, drug addict. He was arrested and they gave him an option. They said diversion, which was go to Walden House, or go to jail. He chose Walden House. He's been out for about 4 years, very successful, recently got married. And you know, it's a success story, and I think some of these success stories are really being ignored.
What do you think, Jennifer, about that idea of get sober or go to jail if you're suffering from, I guess, drug addiction on the street? And then I want to bring back that mental health question too.
Yeah. So I want to kind of back up a little bit on this particular question, if you don't mind. When I first started doing work in San Francisco, my focus was on substance abuse and mental health, and I led the Treatment on Demand campaign. And at that time, you know, and this is going back a little ways, but between 97 and 2000, we had what we thought was a massive overdose epidemic. We were experiencing one fatal overdose every 3 days, and there was a
That's child's play compared to your numbers.
Yes, exactly.
Child's play.
It's 3. Yeah, now it's 3 overdoses a day. But at the time, everyone was living NAFTA. Black tar heroin was really cheap. very plentiful, easy to get, et cetera, et cetera. And what we did at that time is that we were successful, and I'm using we in the broadest, I'm not trying to take credit for this, a lot of people working side by side on this, a huge collective effort with the mayor at that time, Willie Brown, with Department of Public Health, with a lot of different community-based organizations, and we were able to drop down dramatically the overdose rates in San Francisco. And how did we do it? How did we do it? We decreased demand, right, for the drugs. We decreased use. And that really was the huge focus. We expanded the treatment system by 1,200 slots. We looked at the treatment system, we reached out to drug users, we got a ton of information from them on what needed to change. We looked at all the research at the time, we looked at the best practices, and we said, look, our system right now is a failure. We had a system that was all about attack therapy, social model. We had a system that even though people were overdosing on average of, they were relapsing an average of 8 times, we had a system that wouldn't help you until you were clean and kicked you out if you relapsed. So in other words, when your symptoms were increasing, that's when our system took away the treatment, okay? And so we had to change up dramatically, and we had to look at those populations that weren't being served, put a lot of resources into the African-American community that was very underserved at that point, the Samoan community, sex workers, I could go on and on. There was a lot of work that was done, and we looked at changing the way we were doing stuff. And no longer were all of our system is abstinence-based. You can't obviously use street drugs inside a treatment program right now, but if someone does relapse, there's a way for them to get back in, and that had to change, and that's called harm reduction. And so we had to make sure that people were getting help when they needed it. That's called harm reduction. And so we were able to, but what happened? That entire system was slaughtered during the Great Recession. We had $40 million in direct service cuts. So what that meant when the fentanyl crises came today, we were completely unprepared. Completely unprepared. Our system was already in shambles when this thing hit. There is so many solutions around substance use, so many solutions that we need. I'm just going to talk about a couple of them just really briefly.
And then Adam, feel free to respond.
We have people with severe mental illnesses in our Department of Public Health SAR system. 66% have a co-occurring addictive disorder. You know how much dual diagnosis treatment we have in our system? Barely anything. Almost all of our folks who are suffering from severe addictive disorders have severe trauma. You know what? When you have money, or if you're going to the VA, you can get treatment for trauma. We actually have developed now, we didn't back all these things back when I was talking about it, but we have trauma treatment, we have cognitive behavioral therapy, we have cognitive processing therapy, we have narrative exposure therapy, we have EMDR, which is that rapid eye movement thing that erases the trauma. We have all these things that work really, really well. And if people's underlying addiction has to do with their trauma, and our substance abuse treatment system does not have any trauma treatment in it, what the hell are we doing? And so we have got so much work to do. Throwing stones at harm reduction is ridiculous. We have got so much work to do.
All right, guys. All right, thank you. I have to enforce the no reaction things. I do want to just bring you back to the question, though. At what point do you think someone should lose their ability to have agency over whether or not they can take care of themselves, and the government needs to step in and require them?
I think shoes are a requirement.
Okay, let's try to keep this. Maybe that was serious. Maybe that was serious.
I'm 100% serious.
Okay, but
hey Manny, I'm 100% serious.
Okay.
Shoes are a requirement. There are people on my block right now without shoes.
Okay. And are you saying that if someone doesn't have shoes, and they should lose the agency to take care of themselves?
I think that we need medical professionals to actually screen these people and figure out what their real needs are. One thing that I have a real issue with, and I'm going to say it out loud, how in the world do you ask a fentanyl addict who's in a tent high if they want services? You have to give these people a time to decompress a little bit. give them an opportunity to take a shower.
So what does that look like? Does that look like
give them hope?
Does that look like, real tactically in your mind, does that look like taking people from their tents against their will?
It looks like building a facility with all these billions of dollars that has a shower, like 10 showers and bathrooms, and you can't get high in there. But you could store your stuff in a locker for 15 minutes while you shower, get a snack. It's a place called Hope House that I've invented. Hope House. They can draw, they can eat, they can sign up for job training. They're provided with hope. They can get connected to their moms. Shout out to the moms. The moms always support me. I stand with the moms. Ask the moms what exactly their kids need that are sick and dying on the streets right now. Ask the moms.
All right. Well, right now the conversation is between the two of you. I want to just get to this question of what is that point where you take someone's agency away in terms of taking care of themselves, and then we'll move on to the next question.
Yeah. I mean, I'm not, in terms of the Coalition on Homelessness's position, we're not opposed to conservatorship. If someone is, harm to self, gravely disabled, harm to others, and that may or may not be a permanent situation. And I want to just add to that, it is a more effective system, make sure that the individual doesn't get to that point, so that they have the support, they have access to mental health treatment, and so that there's not these frequent psychiatric crises that are so debilitating and so problematic. And so we've failed in that area.
Right.
And then when people are hospitalized, we're also failing in making sure that they then get connected to care after they're stabilized. Because oftentimes a hospitalization will stabilize folks. And then, the last budget legislative analyst report found about 1,700 people that were leaving psych emergency services without any connection to care whatsoever. And so that's a real huge issue too. So you gotta look at the whole and not just the one piece.
But what I heard was harm to yourself, harm to others. Is there some consistency? Here's an example. Maybe I'll bring you into the real world.
I have an example.
Okay, go ahead.
An overdose.
So
I think if somebody overdoses on public property in the street, I think that at that point they should be at least required to go to the hospital.
Okay.
My friend Steven overdosed about 4 or 5 months ago. His brain stopped for about 10 minutes, and my friend found him. And the reality is that he hit his head so hard on the ground during the fall that his brain has never repaired, and he's not the same person. He was not required to go to the hospital.
Okay, Jennifer, what do you think about that? If someone suffers a near-fatal overdose on the street, should they be required to get care against their will and taken into, I guess it sounds like, some kind of sobering center?
Just a ride to the hospital.
Well, let her answer.
Yeah, I mean, I think it's going to depend on the situation, and I think you would have to be really careful.
Guys, let her answer. She's
how
allowed
to craft that, because again, what I'm interested in. I mean, I know this stuff is really difficult, y'all, and I feel your frustration and I feel your pain, and I also think that a lot of the kind of reactionary responses to things, end up actually being counterproductive. They don't actually lead to the results that you think they're going to lead to. And so, for example, on the jailing thing, everyone's like, okay, someone, people, we want to put people in jail. Well, what's happened? We've been increasing our jailing since the beginning of the year. We've been arresting hundreds and hundreds of drug users. And what's happened? Our fatal overdoses have skyrocketed. Did you know that if once you're arrested, that you're 10 times more likely to die from an overdose upon release? 10 times more likely. So it seems like a good idea. Let's get them in jail, and then they're going to be able to be forced to stop using. Well, okay, I'm sorry, but there's a lot of drugs in jail. Okay, so that doesn't work either. So you've really got to kind of go with the evidence-based stuff that's working. A lot of the things that are being talked about don't end up getting us where we want to go. Where do we want to go? We want to get to a place where people are healthy, where they're meeting their health goals, where they're mentally healthy, where they're recovered, where they're in stable housing, where they can thrive, where all that brilliance we can capture again. That's what we want to get at. And having these kind of like, throw them in, you know, this place, throw them in that place, it ends up layering on trauma, and it makes recovery all that much more difficult. So you guys can,
I'm sorry to interrupt you.
Yeah.
I just, you know, one thing that is completely ignored here is the trauma on the residents. Completely ignored is the trauma on the residents. I mean, you know, the actual, like, you know, the partnership that's recommended between the homeless and the residents and doing things. I mean, I probably fed 1 million meals to homeless people. 1 million meals probably. And you know, it doesn't...
Should I give our reactions to ourselves, please?
It really doesn't make sense because I am still toxic to you.
Well, let's try to...
I want to talk about that real quick.
What do you want to talk about in particular, Adam?
In the San Francisco Chronicle recently, there was a profile written by Caleb Pershin, and I wanted to have an opportunity to ask Jenny why she explained me as toxic.
Okay, let's take this opportunity, if you're comfortable with it, Jennifer, and ask. Let her answer the question. You know, two people. Why did you say that Adam is toxic? And let her answer.
Yeah, I think the quote was, I think he's well-intentioned, but his messaging is often toxic. And the reason that I said that, also you accused me of murder and you've done like a lot of other stuff on social media that goes after me.
Then you can respond to her.
Yeah,
just
and so that, you know, but that aside, I think that what is happening in a lot of the debate is that we're dehumanizing folks and really just kind of throwing, you know, basically throwing eggs at a lot of different people who are working very hard to solve the issue instead of constructively engaging in solutions. And so I would like to see, and what, you know, is, you know, for us, for example, like when we're taking photos of, you know, we have ethical like people have to sign a release on a media stuff. We really try to make sure that images are empowering, that they're not going to end up hurting the people down the line when, you know, people are in this place for a moment. It's not who, you know, as some people would say, it's a state, not a trade. And as they're able to recover and as they're able to, you know, images on social media stick with people for a long time. That can really be damaging when they're trying to get work and when they're trying to do these different things. And it can be really, you know, stigmatizing, shameful for them. All of these things can happen. And so really, you know, from our perspective, we'd, you know, yes, I know they're in public space and all of that, but from us, from an ethical perspective, you know, we really try to be careful with that in terms of consent, and we're not always perfect, and I'm not expecting you to be perfect by any means, but we try to keep our, you know, in terms of being constructive in our social commentary on social media, and try to really elevate things so that we're focused on solutions. And the other thing is, when we talk about the residents, I just want to say, this is where we can all come together. And the reason I talked about the treatment on demand stuff going back in the early days is that we were working unified as a city. We were recognizing that there was different approaches that all worked simultaneously like a beautiful pie that's put together with a lot of different pieces. That's where we all have to be at. This you know, just constantly throwing eggs at each other, it's not getting us where we need to go. And that's where I perceive a lot of times better someone's coming. And I do appreciate, and the reason that I was willing to debate when I first heard about it out in front of the courthouse a few weeks ago, is that I do think that you're coming from the right place on this stuff. And, you know, and I just encourage a more constructive conversation.
Well, there you have it, and that's why I'm here for the debate. So,
okay, that was
good answer.
That was. Thank you for sharing that.
Safe.
Okay, that was good. Let's just get to the real meat of this, which is how do you think San Francisco can? How do you think San Francisco can realistically remove all tents from public spaces? Is it what do you think the path to doing it actually is?
I'm going to start real quick. I think that...
and you can take as much time as you want, just like she can take everyone gets as much...
I think that
and let you go finish with whatever you want to say.
Shelter first is important, and housing should be a reward. I think that you need to get people under a roof and you give them an opportunity to shower and clean their bodies and do the things that normal humans get to do. I think that what we're learning tonight is that dignity is very important to Jenny and her group. And they really want to make sure that the voices of the street people are heard, and that's what I do. I echo those voices. If you've ever seen me interact with Jessica or Steven, you would understand that those are my two best friends. My two best friends are homeless, Jenny. I don't know if you knew that. Jessica Didia and Steven Nickel. You can see them on Better Soma, but I spend a lot of time with both of them. And I am very close with them, so I have a direct tie to the actual people who are homeless on the streets.
Okay, so I'm hearing shelter first, housing later. What else would be in your plan to address street encampments?
We really need to set up MASH type medical facilities and interview these people on the streets and find out what kind of medications they need to balance them out. Somebody may need a little bit of Prozac, somebody may need a little bit of medicine for schizophrenia, but it doesn't do any good leaving them on the street, allowing them to buy deadly crystal meth or deadly fentanyl from the Honduran nationals who are never checked.
Okay, I feel like MASH is like a Gen X reference, maybe? MASH? MASH. You said a MASH type.
MASH.
What is that? Is that like Buddy Holly kind of thing, or like
MASH type hospital, like an outdoor? You don't, and no one gets it. So
no, Jenny gets it. What's
like
that?
A MASH type hospital would be like bringing a cruise ship up and developing that into a hospital where it's kind of an, you know, not the same as a regular UCSF Zuckerberg hospital.
Got it, like a field hospital type.
In the field hospital.
Okay.
A temporary in the field hospital.
Okay, so let's see if there's, so we got temporary.
Where there's a war zone.
Yeah, temporary in-field hospital where there's a war zone, shelter first, housing later. And is there any, what else would be on your plan to address, to basically have all of the street encampments not exist on the street? What, is there anything else that you would want to have happen or that you would do?
We have to stop allowing them to come here. There has to be a stop to it. There has to be a final list.
How would you do that?
I don't know. That's Jenny's job. Jenny, I mean, there needs to be better tracking for these groups. I mean, really, you know, it's crazy. I just saw a kid yesterday. I asked him how long he's been here. He said 3 days. He came from New Hampshire.
Okay. So stop people from coming here.
I mean, people come here, it's the cheapest fentanyl on the planet. It is the easiest place to sustain on the bottom with zero consequences, without ever hitting rock bottom.
Okay. Do you have anything else on the plan? No.
I'm done.
All right. Thank you. Jennifer, what would your plan be to address homelessness? And would love for you to respond to some of the ideas that Adam presented.
Yeah,
in the mic, though, please.
Yeah. All right. So, what you're describing in terms of the first part is a drop-in center. We also lost a lot of those. We lost about half of our drop-in center space, and we've during the Great Recession. And so
let her answer.
Between 07 and 12, and we had some really fabulous places that did exactly what you're talking about in terms of bringing folks in. We continue to have some of those. I mean, we've got here in the Mission, we've got Gubbio and Cap Street, and we definitely don't have enough capacity in those. And it's a wonderful place to engage people in services and get them connected to care. And I agree around the physical health needs that folks have, and really trying to have a medical approach to these, a health-based approach. I'm just going to talk about a little bit solutions in the bigger picture in terms of what a well-functioning homeless system looks like. And what you want to do in a well-functioning homeless system, and it's pretty hard to find in the United States because the federal government has basically washed its hands of this issue, which is why we're facing a lot of the things that we face. And so what that means is that the problem, this massive humanitarian crisis is left to the local municipalities that don't have the tax base to really address it. What we did in San Francisco, Coalition on Homelessness, along with a lot of other folks, is we put Prop C on the ballot. It got held up in court for a couple years. It's been slow rolling out as government does move slow. But by the end of this year, we're going to have over 4,000 people that are going to be housed that were formerly homeless. We're going to have over 600 treatment beds. We're going to have over almost 1,000 new shelter beds. And we're going to have, most importantly, on the prevention piece, we're going to have prevented about 7,000 households, and I say households, could be a single, could be a family, from losing their homes and becoming homeless. What we have to do to have a functioning homeless system, one of the first things we have to do is we have to prevent people from becoming homeless in the first place. Last year in San Francisco, for every one person, you know, that we got off, we had 5 more people becoming homeless. We had a huge jump in our Latino population during the pandemic, a 50% increase in Latinos experiencing homelessness. Obvious reason why: service sector workers lost their jobs during the pandemic, lost their housing, right? And so had there been available short-term subsidies to carry them through that job loss until the jobs came back, then they would have stayed in their home and they would have had cheap rent. And instead now they're struggling to try to get back into housing. And of course they're not prioritized because they're recently homeless. So the way the system works is you have to be homeless in San Francisco for a long period of time before you can get housing.
There was an eviction moratorium
and so,
for the entire
well, so low income.
hold on.
So low income people.
There was an eviction moratorium.
Yes, there was an eviction moratorium, correct. And so for low income people and poor people, just, you know, for folks who aren't familiar, a lot of folks live without leases. They live in shared housing. They live in garages. There's a flat, and each room has a different household. They rent from a master tenant, and when they run out of money to pay for the rent, they're asked out. They don't get their tenant rights respected. So yes, we had an eviction moratorium, but it didn't extend to folks who are, and that is basically who we're talking about in terms of who becomes homeless. And so,
so that's a greater problem. That's a city problem. Sounds like those are illegally placed apartments that DBI needs to look into.
Well, so you get DBI involved, and then you create more homelessness,
but yeah,
right?
I mean, that's what I'm saying. Is
yeah, but
they should have the protections if they signed a lease.
No, people don't. Most people about half the people who become homeless were housed in a place before that this is a San Francisco data, that they did not have a lease where they lived. And so that's how a lot of people live, you guys. Like, not everybody has like a formal relationship with their landlord. And so those are the folks that are, you know, so that's what ends up driving. But if you have access to short-term, medium-term, and long-term rental assistance, so, you know, we have a lot of seniors in San Francisco who've been becoming homeless because their rent slowly climbs up above their Social Security. So we need a long-term subsidy for them to keep them in their housing. A huge indicator of whether someone's going to become homeless or not is whether they've been homeless before. There's all these things they can look at to kind of figure out what's the risk of homelessness and then have an intervention to keep them in their homes. So that is a huge thing that we failed at, not only in San Francisco, but across California and across the country. We've got to have more prevention. The second piece is that if we can't prevent it, domestic violence, fire, you know, these things that we can't prevent, we want to have shelter available for them right as that happens, so that they don't have the negative impacts of being on the streets. If you look at it from a health perspective, your health is going to be most damaged out on the streets. It's going to be slightly less damaged in shelter, slightly less damaged than that in an SRO, but your health outcomes are going to be a lot more positive in decent housing. But so you want to have the brief stay in shelter that then moves into housing. Shelter is not cheaper than housing. It has not been cheaper. It costs more because you need 24-hour staffing. It is cheaper to put people into a private market rental. We are paying $70,000 a year, mostly in healthcare costs, to keep people homeless. It would cost half that to give them rental assistance with support services and put them in a private apartment. And you know what? For folks in recovery, that works fantastic, okay? Because it's, you know, scattered site and you're not around a bunch of people and you get triggered on your relapse because there's a bunch of people using.
If I might just, I'm sorry to interrupt because I know you're giving the whole plan, but if you can talk, because I've heard before from Adam and from others about congregate shelters where, you know, New York has a system where anyone can go into a congregate shelter, there's a right to shelter. And so would you support building more congregate shelters in the city?
We need more shelter, but it needs to be balanced with a investment in prevention and investment in housing, so that because shelter is more expensive, if you have too many people going into shelter and no people moving out of shelter, those slots fill up, and we end up happening in New York, a system that's bogged down where they're spending massive amounts of money and people are still homeless, and their health outcomes are not that much better. And so what you want to do is yes, we absolutely need more shelter, and we need more prevention, and we need more housing, and of course I mentioned treatment. The access to these systems, and this is a big priority for Coalition on Homelessness, has to be simplified. We have the most complicated way to treatment, to housing, to shelter. It's too much. It needs to be simple, and it needs to be equitable. And then I just want to mention really quickly, the reason that is so complicated is we have a scarcity-based system. So when you have 10 widgets and 100 people trying to get them, the bureaucracy responds by, okay, let's prioritize who wants it the baddest, like who's going to go through the most hoops to get it, and then they design something that's very complicated, and that's the system we have. It's really difficult to access. So I
might just ask that this be the final point, because it's a very full plan, which is good.
That's
but
it.
We have 5 minutes left. Woo! Okay. Awesome. I guess I just want to have one final question on the specifics of this, and then maybe you kind of close it out. And that's the injunction is about citing people and arresting folks, if I'm not mistaken. So I want to ask kind of each of you, and start with you, and maybe you can discuss amongst yourselves, like, when would